الحمد لله والصلاة والسلام على رسول الله. أبدأ بقوله تعالى بعد أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ثم جعلناكم خلائف في الأرض من بعدهم لننظر كيف تعملون. وقوله تعالى تبارك الذي بيده الملك وهو على كل شيء قدير الذي خلق الموت والحياة ليبلوكم أيكم أحسن عملا. ليبلوكم أيكم أحسن عملا. Let me share first if I am successful in sharing. Is the document shared?
Yes.
Okay, so this session is made of three parts as the first one. I'm going to introduce in 25 minutes. Hopefully I can manage within the 25 minutes or less. Then we will split the group into different rooms as well in an exercise similar to the previous one. Then we meet again to discuss collectively. Hopefully we will finish by 12 o'clock. The session is the International Rubric-Based Evaluation Training, rating the self-evaluation report. How to rate the self-evaluation report. In order to evaluate the self-evaluation report, we have to have enough documents. First of all, we have to be familiar. We have to familiarize ourselves as evaluators with the AA rubric. Then we should have another document. We receive it from the faculty applying or the program applying for accreditation called the quality manual. And some programs call it the quality handbook. And third, the self-evaluation report, which Dr. Khaz has talked about a bit extensively earlier. So we have to have these three main documents in order to start, and we are talking about the evaluator role, how to deal with these three main documents. What are these three main documents? The first one, which is the IAA rubric. The IA rubric is a document. Normally, I guess that you should have copies of it. What is it? It is a set of criteria that defines the quality requirements in 5 areas of performance at each academic institution, or more precisely, each academic program. As Prof. Khalas mentioned earlier, we do not give accreditation to institution, we accredit programs. This document is made of 5 main sections. The first one is, and we rate it as A section, which is quality assurance system. B, which is the learning and teaching section. C, research and development section. D, social contribution. E, governance system. Each of these 5 sections have main criteria. 4 in the first section, 6, 4, 3, and 5 main or major criteria. Each of these criteria, they make 22 major criteria. These criteria are split into sub-criteria. In the quality assurance system, there are 11 sub-criteria. In the learning and teaching, yes? The learning and teaching, yes, I can hear someone talking.
Dr. Mokhtar, no problem.
No problem. Okay. The learning and teaching section or area of performance at each program has 22 sub-criteria. Look, this is the most important one. It's about 40% of the total criteria or total requirements of quality in each program. Dr. Khalas also mentioned that when we rate it over 1,000, this is rated out of 400. 400 points for the learning and teaching. Research and development is 9 sub-criteria. Social contribution, 4 sub-criteria. Governance system is 9 sub-criteria. As you can see, this is 200 points, 400, 150, 100, then 150. It's 58 sub-criteria rated overall out of 1,000. Why should we have such a document? It is a guide first for the institution, for the program management to apply quality and to write the self-evaluation report. They have to follow the steps of this. It's actually called the guide to write self-evaluation report. They have to follow it step by step. And the paragraphs of the self-evaluation report are titled under the sub-criteria and the main criteria. Second, it is the measurement tool for you as evaluator, for us as evaluator, to use to decide each criteria level of maturity. Each criteria should be, and we will see what is the level of maturity and how to decide it. So in order for the evaluator to decide how much, what is the level of maturity, what is the level of quality achieved by the program in this sub-criteria, we should refer to our reference, which is the IAA guide to write the self-evaluation report, or the rubric. It is a reference when evaluators, also Prof. Khalas mentioned that when we are evaluating the program, we are a team of 3, 4, or 5, we may disagree. I would consider that these criteria, the sub-criteria, the program can be rated at 4. But my colleague disagree, maybe slight disagreement. No, it's 3. But there sometimes we face differences between the evaluators between 2 and 4, for example. So we have to refer to the guide, we have to refer to the measurement tool, which is the criteria, and we see the requirement. We say, for example, I say, for example, that this sub-criteria, it can be rated at level 4. But my colleague asks me clearly, where is the monitoring system? The faculty has a plan, they have lots of activities, but there is no monitoring system at all. So I have to accept. And many times when we disagreed about some evaluation level, we accepted when we referred again to the to this measurement tool. We have to agree, but not necessarily always we agree the same evaluation level. Sometimes we find disagreement, and it depends on the way the team is led and the discussion. Sometimes some differences remain after the evaluation. So this is the first document. It's a reference. It's a tool of measurement. It's a guide first for the faculty, for the program to write the self-evaluation report, and second, for the evaluation team to agree about a level of maturity for each sub-criteria. This is the first one. So when we go, we get this one from IAA, and we have to refer to it. The second document we receive from the program applying for accreditation is a quality manual or a quality handbook. The quality handbook is a description written by the academic institution it's a description of what they should do to achieve the IAA requirements in each sub-criteria. So they are not describing what they are doing. I assume that before starting their work, they have to put this handbook there and they follow it step by step. I expect the quality manual to be written in a form of the program should do so and so and so. The program should have so and so. We commit ourselves to doing so and so and so. And it's quite different from the self-evaluation report language, which we will see later. The quality handbook or manual can be written in a form of a table. What is the sub-criteria? Who is in charge of what? Who are the stakeholders? What is the system we follow to apply the sub-criteria? And if we find a good, well-written table that describes the sub-criteria, what the faculty does, what the program does in this sub-criteria, it may be enough. Why should we have the quality manual? It serves as a roadmap for the academic institution to achieve quality in its academic program. The evaluator would not value it or would not give a maturity level for the quality manual. But when we read it, we can understand whether the faculty understands what they are doing or there is a misunderstanding, or they do not cover all the requirements. They do not commit themselves to all what is required in a sub-criteria or in a criteria. But it serves for the quality for the program more than the evaluators. The third document, the third main document, which is the self-evaluation report. It's a report written by the academic institution or by the academic program applying for the academic accreditation. I said written by the academic institution applying for the academic accreditation of a program, because we give accreditation to programs. The self-evaluation report describes to what extent the program has actually exemplified what the quality manual has claimed. We talked about the quality manual here. It's a claim, it's a commitment, it's a declaration for roadmap. Here, the self-evaluation report should be written in a form of informing the quality evaluation team that we did so and so. We have a plan, we have a system, we have a procedure, we have this document or that. So they are informing us. They are not telling us we should do, we are going to do. If they say that we are going to do, they have not achieved the quality level. If they say we did, we have been doing so and so, then this is the quality. We have to, we accept it. The self-evaluation report must be based on facts. It's not assumption, it's not claims. It describes facts, not claims. And it should be, it must be supported by evidence. If the program says, we have defined the learning outcomes of our program or of our course, we have to tell them, what are they? Show me. If they do not show, then it's a claim and it cannot be accepted. We do not rate it. The self-evaluation report must be based on facts, not claims, and must be supported by evidence or by proofs. The applying institution should decide a maturity level for every criterion. So the self-evaluation report is made of 58 sections. Each one describes the quality level of a sub-criteria, the sub-criteria that we described here. These 58, there should be 58 paragraphs in the self-evaluation report that describes to what extent the program has reached the requirement, the IAA requirement of quality in this in that sub-criteria. Without providing evidence, we do not accept it. Many programs, they claim that they are at level 5, for example, but the evaluation team may rate them at level 2. Why? Because they could not find the evidence to prove that they are at that level. How do we rate a maturity level at level 1, 2, or 3? It is here, as you can see. Every maturity, every sub-criteria can be rated at level 1, 2, 3, 4, or 5. We've got 58 of them. Each one has its own requirement, but in general, overall, if a program comes to IAA and they say, okay, the management, the dean, the head of department, whoever comes, they say, I'm applying for accreditation. We tell them, do you have any documents? Can you write your self-evaluation report? They do, but they do not provide any document at all. Then they are at level 1. When we read the self-evaluation report, if the sub-criteria, they do not provide a plan, they do not provide implementation, they do not have a policy, they do not have a system, they do not, whatever is required, as I show in the second slide, then they are at level 1. If the requirement is there in terms of documents, I have a plan, I describe the system, I have a policy, and we can see the copy. But when we check in the self-evaluation report first, they cannot explain to the team that they are following that policy, that they are implementing that plan, or they are following that procedure. So they have a document, it's very well written, but it's in the dean's office, it's in the head of departments, at the hand of department's hand, but when we go to the application, it's not there at all. Then they are at level 2. If they have the plan, they have the requirement, they have the documents, they have good application that covers most of the fields, that cover most of the area, but they do not have a systematic monitoring system. They do not monitor their practice, then they are at level 3. They can reach level 4, which is ideal if they have all the documents, if they have the plans, if they have the system, if they have the procedure, if they have the policies, whatever is required. They have good application that covers all the fields, that covers all the areas, and they monitor it systematically. There is a system of monitoring. It's not just casual monitoring from time to time, but for example, every 6 months or every term, every year, they have a time when they have to review what they've done and they have to evaluate it. And more than that, they have to consult their stakeholders, the shuraka, those who share the benefit of this program. If they consult them and they apply, they listen to their views and they put it in practice, then they are at level 4. They can reach level 5 if another institution approaches them and asks them to take that sub-criteria as a model. Of course, we are talking about every sub-criteria have to apply this system from 1 up to 58. They can be at level 5 if it is taken as a model by other institutions. What is the maturity level? Let's take one sub-criterion, which is sub-criterion A11 in the quality assurance system. Does the program has a mission, vision, strategic objectives, and targets? And this is the rubric written by IAA. The program should be at level 1 if the institution does not have this requirement, which is colored by yellow here. It's at all levels. We mention what is required: the vision, strategic goals and objective, vision, mission, vision, strategic, up to the end. The strategic objective targets as part of their strategic plan. So this is the requirement. If they do not have it, they are at level 1. If we, and I would consider the lack of strategic plan as a barrier here. I cannot proceed. If they write a self-evaluation report and they do not show that they have a vision, mission, and strategic plan, I stop there. They are at level 1. If they have the vision, mission, and strategic objectives, I can open the gate here and go to level 2. The institution has a mission, vision. But the problem here, there is no practice. Then they stay at level 1. I cannot proceed. I cannot pass this gate. If they have a practice that cover most of the areas, that must cover most of the fields, then I have the gate to open this gate. I have the key to open this gate and proceed to level 3. They are at level 3 if the institution has some practices implemented in the entire institution. Look at the entire institution. And certain results have been obtained. But the problem here, they lack the monitoring system. They do not have necessary mechanisms to monitor their application, their implementation. Should they have the monitoring system to monitor their application, they can proceed to level 4. The practices that cover all the fields, and I highlight here the key terms, all the fields, they are systematically monitored, systematically. It's not occasionally. They cannot pass it. When times arrive for monitoring, they have to stop and monitor in compliance with the institution internal quality assurance system. And there is another key term here, this implementation that covers all the fields, all the areas. The monitoring results are evaluated with stakeholders to take necessary measures. Here they are at level 4, and level 5, the only difference between level 4 and level 5, the most important difference is some of the implementations which are specific and innovative are copied or are required to be taken as a model by another institution, then they should be at level 5. These are the main ideas. Now, we would like to apply this to a section selected from a self-evaluation report. We have 5 case studies. In each case studies, I selected the self-evaluation report section of 2 sub-criteria. One of them is in the quality assurance system, A11 and A21. I provided in the document you will find in the next room IAA rubric. Because due to shortage of time, I did not put the quality manual, but you can imagine that the faculty has a quality, or the program has a quality manual, but you will have the IAA rubric and the self-evaluation report in 5 self-studies, one from the quality assurance system, second from the learning and teaching, third from the search and development, fourth from the social contribution, and fifth from the governance system. I will visit the rooms to answer any question or if you need any help, but we will pass it to you in every room, in 5 different rooms, and we would expect that you spend 25 minutes trying to evaluate the self-evaluation report provided in the light of the rubric that is also given to you. Don't spend much time if the if the evidence does not open, and also if you cannot cover the two sub criteria, it's not a big deal. But if you have enough time, can you please do the two criteria? It's 24 minutes now. I pass it to Dr. Rifat to open the rooms. I wish you a successful training program, and thank you for listening to me patiently. So can we start, for example, with the quality assurance, the first theme? I don't know who can share the document. Okay, maybe I share. Quality assurance. So can I ask team number one from case study one, if you can kindly tell us about the evaluation of the maturity level you decided for A11 and how? Yes?
Ustaz Mokhtar Badri,
Yes, please.
you can explain some evidence about quality assurance system.
If you can see the maturity level here, the institution is required to have a mission, vision, strategic objectives that are defined within the scope of a strategic plan. So they should have a strategic plan, and the strategic plan has a vision, mission, and strategic objectives. If they have it, then they should be at level 1. If they have it, but sorry, if they don't have it, I'm so sorry. If they don't have any of this, they are at level 1. They've got a good intention. They would like to apply for accreditation, but they don't have a strategic plan. So we tell them, for this one, you would develop a strategic plan, then we can rate the maturity level of this one. If they have a strategic plan, a vision, a mission, but they have no practice that show that they are implementing this strategic plan, but they have the document, they've got a good strategic plan that have vision, mission, so they are level 2. They have the institution has some practices implemented in the entire institution, and so the evidence, as mentioned here, they should have the strategic plan. They should show the strategic objectives. They should show that they are practicing according, they are following that plan in their practice. They should have surveys to review their practice of the strategic plan. Now, I would like to ask if you managed to read through this report, do they have a plan or not?
as a proof one, quality manuality, I think.
Quality manual, this is, but the quality manual is not a strategic plan. There should be another document called strategic plan. The quality manual should say that the faculty or the program should have a strategic plan. The faculty should decide should set in a collective manner what are their strategic objectives, what is their mission, what is their vision. But it's not a report. They are not telling us what is the mission, they should say, we have to have a mission, we should have a mission, a vision, we should have a strategic plan. When we come to the report, we should look at the evidence here. So in the report, they have goals. You can see this is a goal, this is a purpose one, which is long-term objective, and they've got goals 1, 2, 3, 4, 5. They've got so they have a document, especially if we can find the document here. This is the vision and mission. They have a vision and mission. This 2015, they have a strategic plan. So definitely they should be at level 2. Then we go, the chart of goals, the faculty advisory board. So they have good documentation for the self-evaluation report. And we see here what is the maturity level they claim, the practices that include all the areas that fall within the scope of the strategic motivations and goals are systematically monitored. When they say they are systematically monitored, what level of maturity they should claim? We understand they are claiming. So they've got a plan, they've got a mission, Sorry?
I think
Number five.
So here, when they say they are
systematically monitored.
Number 5.
It's 3. Systematically monitored, they are 3.
Yes,
Let's carry on.
systematically monitored.
Yeah, they are systematically monitored. They are in level 3, in line with the House of Quality Assurance. Evaluated with partners. They added something more. They are evaluated with partners, which then leads to further appropriate steps to be taken. So
Stakeholder involvement.
Sorry?
Stakeholder involvement, this...
So they are at level
4.
I would assume if here from the maturity level, they are claiming that they are at level 4.
Maybe 4 or 5.
5, they cannot be at level 5 because they can be at level 5 if they state here, a faculty, another program has taken our strategic planning system or mechanism or whatever as a model to follow in their place, but they did not claim it here. So they are claiming that they are at level 4. Here, we have to examine the documents. Is it true that they have a systematic monitoring system? If they have, then they are at level 8. If they produce evidence that they share the evaluation, the monitoring with the stakeholders, then definitely they can be at level 4. So as a team, did you level them? Did you rate them at level 3, 4, or what?
We decided 4.
4. Yeah. From the maturity level, it's level 4. But bear in mind, when you go to the field visit, you may discover that it's too much. They don't have the document that they provided. When we actually examine it on the field, they too much said, they too much described what they have. So we may change. Always the maturity, the field visit helps us to make sure whether the documentation and the report that is written is real and is true. If this is true and they have what supports what they claimed here, they should be at level 4. Okay, can we stop this and we go to, I open the following one, which is, this is not
Teaching.
case study 2. See, learning and
Training.
Can I ask a quick question before jumping to case 2?
yeah, yes, please. Yes, please. Go ahead.
Professor Mokhtar, we seen that, you know, the faculty institution has mission, vision, and strategic goals
Yes.
in the previous session. But you repeatedly said in your presentation that we accredit only the program, not the faculty, not the institution. But the mission, vision, and all these strategic goals are the goals for the faculty, not the program. So let's say we accredit only the Arabic theology program. Shouldn't be there a mission, vision, and strategic goals for that specific program only, not the faculty, not the institution, entire institution?
So it's up to the faculty if they decide, if the program management, the head of department or the head of the program, and the faculty members, which is the teachers, they all decide our vision and mission is the same vision of mission and they have to state it. Our vision and mission is the same, and they have to work accordingly. They have to work, and we can see that it's appropriate, it's good. Then we can accept it. If the faculty has a vision and mission that is too vague and it does not reflect what is required of a particular program within the faculty, then we expect them to have their own vision, mission, and strategic goals. But they have to decide it collectively in a management meeting, and they have minutes of that meeting, the documentation that they've decided it, and they are aware of it. But you are right, there's an issue here. We give accreditation for programs, not for faculty. Okay?
Thank you. Jazakum.
So can we talk about the learning and teaching and the team? If you've got anything to say, please go ahead. Is there anyone who want to comment? Okay, if not, we have what is required here. The sub-criterion is student feedback, which means surveys on courses, surveys on instructors, programs, satisfaction levels, system for requests and suggestions. If the institution does not have any of this, they don't have a mechanism to measure, to know about their student opinion on the courses, the instructions, their learning, their teaching, then they are at level 1. As I told you, they've got a good intention. They would like to, they are applying for accreditation, but they don't have anything in this sub-criteria apart of other than the good intention. They would like to have this. If they have a mechanism, let's say at the end of every semester, at the end of teaching every course, they have a survey in which they ask the students' opinion about the course outcome, the relationship between the course and the program objectives. What do they think of the teaching methods used by their instructors, the objectives of the program? Are you satisfied? If we have this, and we have different mechanisms to measure, to get the students' surveys, then they are at level 2. But if they have the student opinion of their program and their course, but actually they do not have any practice out of that feedback, based on that feedback. If they say, for example, the teaching method is not adequate, is not good. So what does the program do to satisfy those students? Do they hold meetings with them? Do they go to the teachers and tell them to change their methods? Do they have their training sessions, for example, to reply to the students' feedback? If they have, then they are at level 3. But they can stay at level 3 only if the feedback is not employed in decision making. So they have the system, they receive the feedback, but they don't act accordingly. They are at level 3. If they do all of this and they share the results with stakeholders and take necessary measures, as I mentioned, like to decide training sessions to improve the teaching methods of instructors, because due to the lack of satisfaction within the student community, then that's good. If the outcome are not that satisfying and they are not that accurate, and they have a session, they discuss and they improve it, then that's good, and so on and so forth. If they can reach level 5 if someone asks them to take any of the practices as a model. I can see that in the program, the maturity level here, the program claimed that in the program, the findings obtained from the practices related to receiving feedback from all students, from all student groups, consisting of different tools with validity and reliability, are systematically monitored. When we find this, first of all, we have to check what is the system, how do they do that, and measures are taken by evaluating the follow-up results together with stakeholders. It's the same thing as the previous one. If they are right, if we find enough evidence of this claim, they are at level
4.
What do you think?
4.
4, level 4.
Yeah, they are at level 4. But once again, this is the claim of the program. This is the claim of the self-evaluation report authors. If we manage, if we study these documents and we find them relevant, then they are at level 4. If any of the elements are not true, now we may not accept it. We may consider, no, the maturity level is too much, and we have to review them, tell them that you are at level 2 until you show that you have a system to follow up the student feedback. Yes, there is a comment.
Yes, Dr. Mokhtar, I have a question. If I make my question, how if we both sides determine that the institution in the level 4, for example, how we can to move to now? What is the process?
What's the process
to move from the level to another, to improve the quality assurance? For example, the team determined that the institution in the level 4. Now the next step we have to take to move to level 5 now. What's the process to move to the next level?
I would expect that if the faculty is clever enough, they should have a good relationship with other institutions, with other programs, and they can communicate with them, and they can tell them. We've got, for example, in the faculty where I work, we know that we cannot reach level 5 unless we there are some people who can benefit and who take some of our practices, good practices, as a model. So we have to introduce ourselves. We have to go to other faculties and tell them, listen, we've got good practices, and our good practices are 1, 2, 3, 4, 5, 6, 7. We introduce them to, and why don't we make a mutual communicating academic community? We learn from you and you learn from us. And if they are convinced and they tell us, okay, your monitoring system for the student feedback is excellent, can we please learn from you? Then they ask us and we send it to them, and we prove to the faculty, to the evaluation team, that there is a faculty that communicated with us and they asked to take one of our experience as a model. This is the way, and it can happen by itself when you are working and you've got good communication with the public and you have a good site, good website where people can see your experience, and they automatically can, without even talking to them, they can grasp the good ideas and they communicate with you and ask you to learn from your experience. It can happen, or you introduce yourself, and it can happen also by introducing yourself.
So the only way to get the certificate of IAA quality assurance to reach the level 5, is that correct?
No, you can get the IAA accreditation of 1, 2, or of 2, 3, or 4 years, even without having anyone who take your experience as a model.
Okay.
But
Mokhtar,
because you can get an accreditation of 2 years only.
Oh,
so you are at level 2 or 3 only. You do not reach level 5 at all. But if you reach level 5 in many sub-criteria, you can get an accreditation of 5 years. Yes?
Dr. Mokhtar, lunch break.
Okay, then we do not have to cover all the, it's just a example. We can do the same thing with every sub-criterion. This is the experience. This is the work that an evaluator does when he's appointed as a team member of the, and normally this evaluation is a collective work. All the team work together. Sometimes they do not agree. It's the role of the team member. Let's say maybe in the following sessions, how can we get to a common agreement about the maturity level within the team itself. I hope that you benefit of this presentation, and meet you in the following sessions, inshallah.
Inshallah.
Floor is yours, Dr. Rafat.